Hey guys, this is Dr. Colin Zhu, and thank you so much for being here with us on the Thrive Bites podcast. This is season 4, and we're so excited for you to be here. For those of you who don't know me, my name is Dr. Colin Zhu, double boarded in family and lifestyle medicine, and I interview the best and most passionate health and wellness experts of the industry on this platform. And we talk about plant-powered living, emotional resilience, and creating a thriving mindset. And this season, we're taking it live, we're taking it on multiple platforms, and we're taking it as a Q&A discussion as well as our interviewing of our guests. So we're super stoked about this, and please remember to like and subscribe down below, and we will see you. Welcome to the next episode. All right. Well, welcome to the Thrive Bites podcast. I'm your host, Dr. Colin Zhu, and thank you so much for being here with us on the show. You can be anywhere in the world, and I'm really, really appreciative for you guys to spend just a few moments with us and with us for our new guest for this episode. His name is Dr. Christopher M. Cirino. He's a fellow osteopath, a DO, and an MPH. He's a board-certified infectious disease and internal medicine physician. He has specific interests in HIV, tropical medicine, neuroscience, and public health. What a great combination. During his work as a physician, he saw the need for resources to empower patients and assist them in addressing their behaviors. He founded Your Health Forum in 2019, starting as a wellness website, and has since published more than 170 articles. He has written also several children's books and organized seminars. Dr. Cirino is an advocate for mindfulness practices and patient self-empowerment. I love it. So without further ado, please welcome Dr. Cirino. Hello.
Thank you so much, Dr. Zhu, for having me here. This is awesome. I didn't even realize initially that this was a live presentation, so I'm really excited to be here.
Well, I'm glad that you're able to roll with the punches, so that's good. Okay, so number one, thank you so much for being here, taking the time out of your busy work schedule to be here with us. And I love pretty much diving deep into someone's origin story of how they got from point A to point B. You have a very colorful background, and I know you noticed that you've made some transitions and changes during your trajectory. So if you can just share with the audience, how did you come about going into infectious diseases / internal medicine, and then made your way into the space of wellness and mindfulness?
Thank you. Yeah, I've always taken an interest in healing, and I was very interested in mindfulness and New Age and those types of concepts, even as a teenager. And the idea of osteopathic medical school fit really well for me as I understood the body being capable of healing itself. I had much interest in HIV as an infection that altered a person's immune system. It was very interesting to me to look into how we've gone from something that otherwise would be consistent with death to being able to have someone live a full life because of treatments. And so looking into infectious disease was my pathway to getting me to understanding about that healing concept. I often saw many patients in the last 20 years during my training, as well as an infectious disease consultant who had come in with infections that were complications of their behaviors. And the infections were sure treatable, and in some cases, unfortunately, led to their death. But it led me to asking that question, what is the upstream question that we need to get to in people who have infections? And it often goes to the idea of behavior. And that's a very challenging thing to address in the clinical setting. And so I engaged in developing a website to encourage a community to develop those skill sets to approach their behaviors.
That's awesome. Yeah, I mean, that's a great, roundabout way to really get to the core. we talk a lot about behavior and lifestyle changes on the show. And, whether it is trying to eat, as healthfully as possible, trying to, establish a good movement-based, physical, lifestyle, or anything just in terms of enhancing, our relationships with ourselves. And then also, with interpersonally, it is challenging, to be able to say the least, how, where was the turning point, for you in terms of, you decided, have you completely kind of phased out of the infectious disease profession, or, are you still doing parts of it, or how is it right now?
Yeah, I still practice infectious diseases. I'm part-time right now, and what I'm doing is a locum tenens type of a mixture, where I'm giving some more time to devote towards developing Your Health Forum, where I'm working on some books at the time. But in the meantime, I'm also working in the local prison, where I'm doing intakes, and it's a great development for me, just to learn more about human behavior. And then I'm also doing part-time work in various sites who need infectious disease. So it's right now the transition really opened up the possibility of developing more writing, more speaking on the very interest that drives me.
Yeah, and you've mentioned that, as a fellow, osteopath, the philosophies definitely spoke to you. It definitely spoke to me when I got into DO school, and I actually only applied to DO school. That's how much, the philosophies and principles spoke to me. So we're definitely on the same wavelength. So I really appreciate that. So let's go deeper into, trauma. Right. And trauma takes on so many different forms. You kind of, brushed upon it a little bit. You have current work into the prison system. You're doing locum tenens right now. I guess the first question is that how would you define trauma, whether it's the psychological base, mental, emotional based, from your niche of, what you do? And how have you observed it in your patients over time to say like, hey, I think we need to really focus on this because this is almost sort of like the roots of many, many different things that ended up manifesting.
Yeah, I mean, it's a fascinating, and there's so many directions that I can take on this. What I would start with is that trauma is a perception, of the brain that there is a significant stressor, and it alerts the response of evading or engaging, disengaging or engaging. And unfortunately, when the trauma is significant or chronic, it can lead to a repetitive cycle as a coping strategy. In a way, our brain is a filter in learning how to cope with stressors in the environment. And we have our amygdala, a part of our brain that sends signals to our body in coping with these, and that is that fight and flight response, which I like to think of it more as an engage and disengage. And that what happens with the trauma is it sort of sets a rippling effect that leads to thoughts and then actions that continue along the trajectory of a behavior. And ultimately that behavior becomes us if we don't reach out of that. And so the brain seeks to maintain itself in dealing with these stressors. It seeks to preserve its energy. And in a way, a behavior is an adaptation to that prior trauma. So we relate to things in the present tense from our past experiences.
Yeah, someone once told me, a colleague once told me is that, when we're trying to create more joy and happiness within our lives, it's oftentimes, a lot of work in terms of trying to embed that into, I guess, our normal routines and behavior patterns and, ultimately become actual actions, right? I like to think of creating joy and happiness as a process as opposed to like an end destination that you kind of strive for. And then on the reflexive, as you're, talking about trauma, it seems like, and you can, tell me if I'm wrong, something that is very imprintable, very, very fast, and very, very deeply, because like you said, it's, our fight or flight response. It's our modern day version of, we're trying to run away from something, right? But in essence, we're not being eaten per se, but it's something so imprintable, your body kind of, thinks that it is, right?
Yeah, and I think part of that's fascinating is that when we experience that, it may be started in the brain, but it's experienced in the entire body. We have our adrenal system that is mounting that fight and flight response, which has major impacts on our brain structure. And so in a sense, what is being realized in the brain is also being realized in the body, and those two are not able to be separated. And so an interesting part to that is oftentimes a thought, even a positive thought, can lead to the development of a future path, to improvement and mindfulness.
Besides the prison system, where are your other audiences from as you kind of observe, trauma-based care, over time? Has, your patient population mostly been, in the prison system, or is it shown up in different ways, or maybe like in your, ID, infectious disease profession as well?
Yeah, it is showing up in everything, in every patient that I work with. It's fascinating because, we may think of, I think of those most egregious experiences where people have had significant trauma growing up, the adverse childhood experience events study, where the amount of trauma in various types led to an increased risk of mental health issues, led to drug and alcohol abuse, as well as physical health problems. And so I do see that with infectious diseases, diabetes, high blood pressure, obesity, and all of these oftentimes is linked to a significant behavioral loop, oftentimes develops sometimes even before a person is cognizant of that trauma. And I'll give you an example. Some studies looking at gestational diabetes and how the offspring has an increased risk of developing diabetes. And so we know, that you think of that example, and then you think of the example of someone who has had, there was a report of maternal childhood or maternal trauma and its impact on the infant. So these things are sometimes not even in our control. They've already developed even before we began thinking of the words associated with things. We've already had,
that's really, really powerful. And for me, I've learned something new called generational trauma, where previous generations, it's not necessarily, you could say that it's almost like being embedded into your DNA and passed forward, but a lot of times it's growing up in a certain environment, whether it's cultural, whether it's like dare I say it, like religious or spiritual related. There's something that is with that type of environment that gets imprinted for the next generation. So my next question is that the topic is how can we heal with compassionate care and post-traumatic resilience, right? So let's go into defining what those two mean, and how does your current role assist and or facilitate with that?
So I would say compassionate care is essentially acknowledging that the individual in front of you has experiences that have led them to developing a behavioral cycle, unfortunately, some of which can lead to harm, ultimately causing physical disease and mental health issues. The compassion part of it comes with acknowledging that, free of any judgment or conclusion. There's no blame or guilt to that other than just understanding as a human being that we all are subjected to various forms of trauma. And when those do stack up, they lead to behaviors that lead to physical health issues. And so I think compassion really comes with, again, the Latin for compassion is to suffer with. And it's the idea that it's really just looking past the manifestation and understanding the underlying processes that are occurring, and just, showing an understanding and love for the other person. Opening the ears, listening to their words, not jumping into conclusions. So active listening applies. As far as the resilience was the other part of it.
The post-traumatic resilience, yeah.
Yeah, so post-traumatic resilience is something that we can venture towards once we acknowledge that the inner core of our behavior is essentially protecting the behavior from being changed. So that post-traumatic resilience is understanding that the behavior is a cycle that does not want to change itself. We need to look past that cycle into, number one, things that I suggest are doing something that's radically different, and that includes physical changes, so doing, for instance, an exercise or sport that one hasn't done before. Also actively documenting one's thoughts, putting things into words creates a chain of events that does allow for one to see the forest for the trees, and in a sense, see through that blind spot that we all have. We all have a blind spot to our behaviors. And so the resilience develops as we develop step by step and a closer understanding of what is going, and unraveling that, we develop greater confidence in the fact that we are changing, and the change itself provokes further change. And so it's amazing just to see this happening in someone's life. When someone says, well, I'm going to start exercising because I need to lose weight. And, most of us would think, well, there's no really a direct association with exercise and weight loss. It's probably a fairly minimal association in adults. But that exercise sets up a new behavior pattern. It's out of the person's comfort zone. And I do often tell people, if they're looking to change, it is going to be uncomfortable. You can think of someone who has IV drug abuse history, and then they decide to stop that drug right away. They're going to develop a significant amount of boredom and pain, and physical findings. Those things are very parallel to any of the behaviors, perhaps less extreme, but think of a person who has diabetes and changing their diet, adding more vegetables, adding less carbohydrates that are processed. So all of these changes are going to lead to some discomfort, and acknowledging that as we grow through these discomforts, we develop confidence and we develop discipline. And that's where the resilience comes from.
That's awesome. Even as something as, I haven't even thought about, just cutting back like the carbs, just something as, as simple as a behavior change like that can also create discomfort for someone. And it makes sense, if you think about it, if someone is used to, being able to eat or, go about in a certain way of their lifestyle, in a way, it's almost like, you're taking something away, from them that's near and dear, right? And you don't know, I guess, until you ask them whether, that is tied to something, right? Maybe it's tied to a family member, something cultural, because like if we're using an example of food, food can be very, cultural, type of thing. So I guess my next question for you, go ahead. Where you go?
I was going to say, think of it this way. Our brain processes rewards and punishments the same way as fight and flight. So those two, they overlap. So you've got dopamine and, the draw to making a movement. And in a way, fighting and flighting, or I would call it engaging and disengaging, can be viewed similarly. It's an interesting thing. The same part of our brain, that deals with rewards and punishments deal with fight and flight. And the implications of that are fascinating, because if you think about it, if we can gear our mind to thinking of something as, instead of being a threat to us, as being a challenge, a creative challenge, we can approach something directly, including our behaviors, in that mindset. And so I just thought that was always fascinating. Fight and flight and rewards and punishments are overlapping.
Yeah, definitely. Never even thought about it that way. So
Yeah.
I remember doing a lecture for my medical school alma mater about how food is very similar to substance abuse, especially with the processed foods, and, how things are. I think it's kind of like almost like the new a new form of abuse, but in a form of, food. So in a way, the way, you're describing, which is, very, very, nice to hear. How does your work, I guess, differ from, I guess, psychotherapy, or, someone that's like, a psychiatrist, or someone that's like, a licensed marriage, and family therapist? How have you, is it similar? Is it, how else is it different? Do you do one-on-one sessions? Do you do group sessions? Like, how do you help to facilitate someone's, trauma, and what kind of settings?
That's a great question. I'm still in the process of developing my process of approaching this. I do seminars at this time, and they're usually focus group level, so anywhere from 6 to 15 people. And essentially what we do is I give a talk, and it's usually, most of it's pictures, and then I go through the story of how our brain develops, and about the history of, about ACEs scores. And then I talk about how addictions and how essentially, when it comes down to it, we approach things that provide us pleasure, and we avoid things that cause us displeasure or pain. And so I kind of talk about that. Then I start broaching the idea of how food as well is an addiction. And essentially every behavior we have is an addiction. That's brushing my teeth, getting used to those things. So it's not, it's sort of changing the words. And so I think the interesting thing that I'm working on is developing this and looking at this in sort of a scientific level. And I think it's fascinating when we come down to a cell, within our body. Every single cell can respond to every other cell. There is this autocrine and paracrine effect, and endocrine effect. So we have 3 different effects where we have this communication. And where I find this fascinating is, if you think about it, the single cell universe, like protozoa, they have the same behavior of approaching something that's attracted to them, a chemoattractant, and then staying away from those things that could be harmful to it. And I think, in a way, when you think of an infant being born, what are the 2 instincts that are immediately known? It has its known, an infant has multiple instincts, but the first thing an infant does is it cries, and it seeks warmth, and it has hunger. We assume that is what is happening. And so, in a lot of things, the things that wrap around those 2 basic things, which is, warmth and hunger, are all, by the way, those are already intermingled, right? An infant is, held and breastfeeds. And so all these other things become nuances to those simple needs. We have such complex descriptions of our challenges that we have, our nuances, our behaviors, and they're essentially similar to eating, and that's why eating can become so raveled with the behavior of needing security, of self-coping. So that's sort of where I come from. I come from that idea of looking at neuroscience, and also at the cellular level, and how we are just massive environment of cells. Yeah, of course we have our wonderful prefrontal cortex, But the idea is our whole body is essentially an interraveling of our vascular system and our nervous system. So that's kind of where I go.
Definitely. And, coming from an infectious disease, background, it makes a lot of sense to go, towards the cellular level. I definitely have a bunch of questions. We're going to take a quick commercial break. And for those that are, watching, if you have any questions for Dr. Chris, please comment or, ask any questions, and we will definitely read them off. So we're going to go a quick commercial break, and we'll be right back.
Okay.
Hey guys, this is Dr. Colin Zhu, and welcome to the Thrive Formula. I'm so excited for you to be here and to be just a little curious about what we do. If you know a little bit about my work, I created the Chef Doc in January 2017, and since launching it, I've written a book about thriving and hosting my podcast called Thrive Bites, where we've reached over 90 countries and counting. It's been a humbling and unexpected experience so far. The main driving force to create the Chef Doc was born out of the need to help others to combat chronic lifestyle-related diseases such as high blood pressure, heart disease, diabetes, inactive physical lifestyle, and simply not being able to cook healthfully. I noticed the same paucity and deficit within our medical school education and also within our medical training across the nation. 2020 for us, like the rest of the world, gave us a new set of challenges. Even with health disparities and racial injustice, I decided to look at things from a very silver lining perspective. And that meant, how do we become more resilient as a community? How do we pivot as a human species? Do I focus on me or us? With so many different people and different walks of life, I realized that we're more similar than dissimilar. And to cultivate a thriving mindset meant a lot of self-work, self-education, and practical tools, but also in conjunction with other people. I could not be where I am without the support and foundation of others. That means right now, more than ever, we need to be unified and we need to thrive together. Therefore, I decided to create this virtual summit experience, gathering and collaborating with over 45 speakers from different parts of the health and wellness industry to inspire, educate, and teach you the tools to thrive, not just in your own life, but also to those around you. And we will do this through the 5 pillars, what I like to call my 5 to thrive. Food as medicine, functional fitness, relationships, community, and resilience. I'm beyond ecstatic for you to be here, and the only question I would ask is, do you dare to choose to thrive in your own life? If you do, then come on in, let's learn together, and I'll see you inside. Thank you very much.
Okay, so we are back. All right. So actually, before we go into the next questions, I want to showcase this. So Adam Mia Fitness and Gaming, he says, hi, can childhood trauma cause personality disorders? And he subsequently writes, I was told it could damage the amygdala.
Adam, very good question. I just want to start by saying I am not a psychologist, psychiatrist. I am a physician with infectious disease background. So to answer that question takes me a little off of my area of emphasis, but certainly my interest. As far as what you said about the amygdala, that's a good point. There are, since the dawn of fMRI, which is a functional MRI, essentially what that is doing is it's assessing the brain's blood flow at the time. So people are asked to think of certain things, and what is the fMRI showing when they're thinking, what parts of the brain, quote unquote, light up. And so there have been some studies. This goes, I'm going to go a little circuitous, but it'll get to your answer. I'll give you an example. So there was a London taxi cab study where they looked at fMRIs of the brain in taxi cab drivers in London streets. And If you don't know about London streets, they're very circuitous and like a labyrinth of streets, versus bus drivers who did predictable things. So the bus drivers in London, they have their same route. And fMRI studies suggested there were larger and thicker vascular areas in taxi cab drivers who are thinking all the time. They're all, so those types of thought processes do increase the size of the hippocampus. This is a different part. And now this goes to other parts of the brain. There were some studies looking at depression and how the amygdala has an increased volume. And the amygdala, they're two little almond size, that's where amygdala comes from, areas of the brain that are centered into our body connections, as well as some of our prefrontal as well. And so the amygdala volume increased in people that were depressed. And the thought process behind this is, if you are depressed, you become better at being depressed. So if you think depressive thoughts, you then develop behaviors and you become just better at being depressed. And so the question about personality disorders, I would like to just mention a lot of things that we do in medicine, we have guidelines. And one of the big guidelines is the diagnostic book, the DSM, and it has multiple iterations. And that is for psychiatric disorders. And I do want to mention to you that I think when we look at the brain and how it is affected by trauma, we really need to consider redefining and sort of bringing it into the modern view that the DSM is fine for its cataloging of these disorders, these conditions, but really, I think looking at what's happening here, a lot of this is brought on by trauma. Now, I don't mean trauma just verbal abuse, physical abuse, but even head trauma has been associated with an increased incidence of schizophrenia. So yes, personality disorders can be a result of trauma. If you think of conditions like bipolar disorder, where someone has flights of mania, and on the other hand, they have flights of depression. In some ways, chemicals are driving this process. Neurotransmitters are driving this process. So I do think that it is a time to come to redefining what mental health is.
Thank you. Adam did write that he said that he thought today's topic was about PTSD. Adam, I do want to say that in later episodes, we do have, we talk about PTSD, something similar to a later episode. So definitely, for those that are interested, in terms of that realm, don't forget to, subscribe and definitely follow. So we'll definitely go deeper into that. But I want to get into it. And he says, thank you very much. You got it. You got it, Adam.
Adam, interestingly enough, you can say 10 things. You can say something to 10 different people and they will take it differently. So you can say, oh, you're an idiot. And 10 people will take it differently. And what I'm trying to say is that, in a sense, what that stressor is depicted by our brain from our past experiences. And just as something can be the most challenging obstacle that leads to trauma, it can also lead to growth. And so there's a significant kind of a flip of a coin, but it really comes with how our mindset is. It comes with the cues that our brain picks up, and it also comes with our mindset. And that's where that post-traumatic resilience comes in.
Awesome. So thank you for that question. So Dr. Chris, I guess a question for me is, in the world, in the current era that we live in, this is obviously, very unprecedented for the entire globe, and it's hitting every industry, every sector, and it's definitely taxed us, as a healthcare system as a whole. In a way, the silver lining could be like, how can we go from here? How can we pivot? How can we become more resilient, right? And kind of solidify all the different cracks in the foundation that we didn't see before. So for those that are, I guess listening, I kind of feel like everyone has faced some sort of trauma, what I'm saying? No matter what type of walk of life, what I'm saying? I guess just being born into the world is very traumatic, if you think about it,
Yes.
what would you say from your studies, practice, and experience, how we can arm ourselves in terms of moving forward, right? From
Mhm.
this point on, moving forward, because we don't know what the pandemic is going to be like. We don't know what the economy is going to be like. We don't even know what tomorrow is going to be like. What would you say are the, best, like, I don't know, three top, strategies that you can impart to our audience to say like, hey, this is what I found, that's, worked well, with my patients or clients or audience, and, anything personal as well.
Sure. Wow. I mean, when it comes down to it, our body is actively, processing as we're moving, as we're doing. And so I would say, number one, do something. And I think what I mean to that is, pick a hobby, pick an interest that you have that you've thought about, but you've talked yourself out of. And I would recommend to pursue that interest. And that includes changing your comfort zone, getting out of your comfort zone. Yes, it is where you meet. It's the pathway where you meet, where you're least comfortable and where those traumas can sometimes open up. But that's also the place where there's healing. So go towards the stressor. Number two, I would say, is be in a community. And I want to mention that to you because we think of, this is an interesting neurotransmitter. We mentioned dopamine briefly, but serotonin, and there's also oxytocin. And interestingly enough, oxytocin is meant for uterine contractions and for breastfeeding. It stimulates the release, but it's also associated with relationships. And it's sometimes been referred to as a love drug. However, neurotransmitter, but it can also be associated with aggression. It's all in the context. But the idea here is that oxytocin also helps with dopamine deficiency. It triggers that. So in a sense, developing a community is, we're inherently raised, we're inherently developed to develop a community. So develop a community that is your small community, or develop a larger community. So that would be number two. Number three is mind your body. And I'm using these two together, but the idea with mind your body is make sure that you're getting the correct sleep, that you're sleeping consistently and you're sleeping for at least 8 hours. And if you are having problems, it doesn't mean to take more caffeine. It doesn't mean to take alcohol if you're having a hard time going to sleep. So medicating these things, it's just going to contribute to worsening the conditions. So if you're having sleep problems, get that checked out by a sleep doctor. But sleeping well and also moving your body for exercising on a routine basis. Essentially what we're doing is we're pushing our body to have a physical change, and that is preparing us for stressors. So it's sort of a coping strategy. And then finally, what we digest. And that includes the food we put into our mouth. It includes the reading that we do. The words come through our brain and we start processing, and we want to tell a narrative. The narrative is, essentially we're in a downward feedback cycle of a narrative in some cases, unfortunately, with the COVID-19 narratives that have developed. So it's not only what you eat, but it's also what else you consume.
I love that. I love that. Well, I hopefully that helps. I really love the part when you said, food as medicine. We talk a lot about food as medicine here on the show, but a lot of people don't associate, like you said, the positive and or negative comments, whether it's for your own thinking or it could be a family member, coworker, significant other, friend. They can have a very detrimental effect if we allow it to. And I think at the end of the day, it's about choices of, what comes through our environments, right? Almost our invisible bubble,
This is what I start with. The very moment the sperm meets the egg, it already develops an environment. The environment is we are already susceptible to the environment. And so I like to talk of 4 I's. I call it 4 I's, but ingestion of food, drink, or other toxins or microbes, inspiration, which is the air we breathe in. And again, these are pretty basic. Next would be injection or injury to our skin. That includes burns, it includes injection drugs, it includes trauma. And then finally, impression. And that's the way our brain shows what is happening. And in many ways, we can cause our own disease through our impressions and our imagination.
Definitely, definitely. And I think, like people, hopefully get by now is that even though the coronavirus, for example, is invisible, it could have a very severe impact on our health. And, just like thoughts, just like, things, that just come at us. So, Dr. Chris, thank you so much for being here. I really appreciate it. Lastly, before we close out, how can people find you? Where can people reach out to you? And I know that you have a website, you have a forum going on, and what do you hope to achieve with, this new trajectory, of your career?
Well, to start with, I am achieving the feeling of fulfillment in what I'm doing, and it doesn't have any money attached to it. It's just the passion of carrying that out. And so I hope to achieve to start with understanding how I am and how I developed. And I'm hoping that through that process, I can learn that, we do have control over how long we live. We have control over our mental health, and we have control over our environment in as much as we do have control over it. And so I hope to achieve, a movement in this way that all of us can become self-empowered. And so right now I have an active blog. I'm writing, it's not my personal experience type of thing where I'm sharing a couple hundred words about my everyday, but I am writing this literature, that are equivalent to chapters of books, step by step in how one can empower themselves in the way that I see it. And I have some interesting ideas that come from it, but I'm working on several books right now. And I do aspire, the editing process is always challenging, but I aspire to get at least one or two of them published in the next year. And I'll also be having health and wellness conferences, hopefully in the flesh, in the real person, but also Zoom conferencing, trying to pivot to COVID-19.
Awesome. And what is the name of your website? Is that or any handle that you would want to refer people to?
Sure. The website's name is Your Health Forum, and it's Your Health Forum by drcerino.org. And I encourage everyone to sign up. It is, although it is not individual medical advice, it certainly can be quite a tool for each and every one to, as they develop, their behavior, as they make those changes and make their journey towards realizing their health. Everyone deserves to be healthy. And, and so I open that up. I remove the shame, I remove the guilt and blame, and we start that first step, one step at a time. Awesome.
Amen to that. So, Dr. Chris, thank you so much for being here. I really appreciate, your energy, the vibe, and all the good feels that, you brought to the show. And, hopefully the audience, got a lot out of it. I certainly did. And, much success to, your present and future endeavors. And no worries. I really appreciate it. Guys, thank you so much for watching this episode. If you like this or you feel like this has been a benefit to you, please share, with someone else, and we will see you on the next episode, Fridays live every Wednesday. So please say goodbye to Dr. Chris.
Bye-bye. I really enjoyed this, Dr. Sue. This has really been, thank you so much.
Thank you very, very much. Guys, thank you so much for watching that episode. We hope you enjoy it. And please remember to like and subscribe down below so you can get continuous updates for future episodes and future guests. And we can't wait for this upcoming season. So don't forget to like and subscribe, and we will